I live in a rural community. I don't know that I would have had access to such a phenomenal high-risk expert if it wasn't for telemedicine. My name is Jill Lee. I am 33 years old. My husband and I live in Caldwell, and in December we had a beautiful baby girl named Joy. We'd had a miscarriage before, so we were a little nervous to go in and make sure that everything was okay. But when I went back for my 12-week appointment is when my regular OB told us that our results were high risk for Turner syndrome for our baby, or monosomy X. And that's when he referred me to Dr. Hyeri. At that appointment, everything with our pregnancy changed. There was no longer the innocence of, oh, we're having a baby and everything's gonna be great and we've made it, out of the first trimester this time.
When you talk about the field of obstetrics and you talk about pregnancy, a common misconception that a lot of folks have is that OBGYNs are not equipped to take care of high-risk pregnancies or to read ultrasounds, and that's fundamentally wrong. There are great OBGYNs out there. They're providing great care to mothers. They're doing great work out there. And maternal-fetal medicine's job is not to come in and replace them. Our job is to support them. So what do we do? So we come in, and if there's a high-risk diagnosis that we know for a fact they're managing very well, but they want to have a second set of eyes just to say, you know what, yes, what you are doing is correct, that's the role that we provide.
What was wonderful is that the high-risk doctor was able to see me the next day. So once a month, starting at 12 weeks, I would go in for a scan with the sonographer associated with Dr. Hyeri's office in College Station. He was getting those images immediately, and he was available to give us feedback on them whenever we were. In my third trimester, I was diagnosed with gestational diabetes, so Dr. Hyeri also wanted to see me starting then once a week. And so again, just instant feedback to make sure that everything, she was developing and growing as she should. It was just easy. I mean, it was very convenient for me because I work in College Station. I didn't have to drive to Austin. I was already taking off for doctor's appointments, so just popped over, had a scan, and then I would talk to him in the evening. I think that even if I hadn't had a baby during a pandemic, I think it still was amazing that I was able to receive the level of care that I did just via my phone.